There you go.
Hello, everyone.
Oh, let me turn that little chime off. There.
Hello.
Hi.
Okay. All right. I got first time I'm using Zoom, so I'm trying to get this.
Oh, well, welcome. Is that Jamie?
Yes, ma'am.
Okay, I'm gonna ask you to mute, or I can mute you. We're gonna go over this in the introduction, but there may be a time when you can unmute and ask a question, okay? But we'll ask you to stay muted. So thanks. And welcome.
Yeah, and we'll get started in just about another minute to allow folks to come on in and all that good stuff.
Oops.
In the meantime, you guys are welcome to share your name and the organization you're with in the chat. You can share a fun fact about yourself. For me, I am Steph Spitz and I work for the Peer Recovery Center of Excellence, so I'm helping support this session today. And a fun fact about me is I'm actually at a conference, NatCon, here in Los Angeles, California at the moment. So I'm coming at you live from a hotel and excited to see all of you and hear this amazing, amazing information. I think a lot of you will enjoy today's information for sure. So feel free to start connecting in the chat. And again, I'll give it just one more moment because we're still actively allowing folks in. So,
yeah. And we're going to hope that the hotel that Steph is at has great Wi-Fi.
yeah. Fingers
Cross
crossed.
your fingers, everyone.
Knock on wood, whatever your superstitious ritual is, feel free. Perfect.
Oh, thanks for putting your info in there, folks.
It's very exciting to meet all of you.
Some familiar faces, names, like. So I will keep an eye on the admittance throughout, just to make sure that everyone can get on. If anybody happens to lose connection, you can come right back in. Just give me a minute to make sure I see your names up there and let you in.
Absolutely. Thank you so much, Cindy. And so in the interest of, being mindful of everybody's time and energy and efforts and stuff, I want to go ahead and kick off today's session. So again, my name is Stephanie Spitz and I work at the Peer Recovery Center of Excellence. So I'm here with my colleague, Cindy Christie, to support Amy Brinkley's session today. And so we will be discussing managing nonprofit financial operations. Now, this is session 1 of 2. So we have the one today, and then we have another one in a couple weeks on May 16th. So please be mindful. This is a part 1 of 2 session. So a disclaimer before we continue on is that funding for this initiative was made possible by a grant from SAMHSA. So the views expressed here in this information doesn't necessarily reflect their official policies of DHHS, mention trade names, commercial practices, or organizations, implied endorsement by the US government. So being mindful of that. And then as we move forward into this presentation, and as a reminder in general, when it comes to the field of recovery and substance use disorder, we strive to make addiction destigmatized. And so we want to use language that is more unified. As we all know, words matter. And so caution being taken, especially when disorders that are concerned are heavily stigmatized, like substance use disorders are. So we will use language like people in recovery instead of addicts, and things of that nature. So just being mindful of that piece, and overall just being kind to one another and kind to the populations that we serve. So if you go through this presentation or this series and some things come up that you would like to request technical assistance on, we do supply technical assistance to individuals here and RCOs. And so you're welcome to submit your TA request. A manager will contact you to discuss it. Throughout the PRCOE, we have different core teams that handle different asks and have specific subject matter experts in different areas. So we want to make sure to connect you to the right people and places and spaces. So we can do that and create a plan for delivering your TA. We're good at delivering that, or bringing in other folks that can do the great work. And then we just ask to have you fill out a survey afterwards to provide feedback, make sure that we were able to assist you and things of that nature, because we do appreciate feedback, positive, constructive, etc. So do know that we are here for you as well, besides this incredible series that you're participating in today. So a couple housekeeping notes before I hand this over to our speaker. So this presentation is being recorded. Please keep yourselves on mute whenever Amy or myself or Cindy are speaking, just for ease. We don't want to, capture noise that isn't, a part of the presentation and things, but I do know there might be a couple places where you can unmute yourself and ask a question and things. So stay tuned for those opportunities. Again, when you speak or in the chat even, feel free to identify yourself, your name, your work area. We want to make sure that others recognize you and who you're representing. During the presentations, you are welcome to submit questions and feedback in the chat box. I myself, Stephanie, will be looking through those, answering or giving, links to information if I can, if it's regarding PRCOE. If it's regarding other content within Amy's presentation, I will capture that. And we will answer questions, I think, about midway and then towards the end as well. So just being mindful of those pieces for sure, because we want to give you the opportunity to engage in the material as well, instead of it feeling like lecture presentation. Now, you will receive the slides for this presentation via email after this takes place. So feel free to sit back and just absorb the information or take notes, but do know that you'll receive the slides. And then again, we value your feedback. An evaluation link will be sent after the second session on May 16th, because again, this is a part 1 of part 2. So you will not be given an evaluation link after this specific section or session. You will be after the second one. And then that's when you can claim a certificate of attendance and other things of that nature. So know that you don't have to worry about that at this point, but be mindful for the next one. And if for some reason you can't attend that session, please do let us know. And then throughout this session, I think it's important to share kind of expectations besides, boundaries and things. And so we're going to delve into financial management today and how to effectively oversee financial operations. This is something that we've been hearing a lot from the field that folks are interested in. So learning that foundation and the importance of nonprofit finance and how, peer-run organizations, recovery community organizations or centers maximize that effectiveness and sustainability when making financial decisions. So we're here to really help you discover the importance of operating a nonprofit with a financial focus, to help you understand how to read balance sheets and make decisions, because that can be a lot. Frankly, it's a lot to keep track of. So we'll take some of that, anxiety out of it, recognize how nonprofit RCOs and professionals within those organizations can utilize financial operations to promote sustainability, because that's incredibly important as well. And then understand how data, how to utilize it in building capacity for peer-run organizations moving forward, either for grant opportunities and things of that nature. So very exciting stuff today. So I hope you're ready with your coffee, you're ready for some numbers and just diving into this piece that we've been hearing a lot of need in for the field. So agenda, in a moment, I will hand it over to Amy to introduce herself. We're going to go through some different levels. So we have a part 1, a part 2, and a part 3. And then you will have a homework assignment as well. So Amy will delve deeper into those. And Now I will go ahead and stop sharing my screen so that Amy can go on and introduce herself. And she is amazing. You're in for such a treat today. So without further ado, Amy, please take it away.
Thank you, Steph, and thank you, Cindy, for all your guys' help. Hi, everybody. I am excited to be here. Steph, as I was watching you read through the objectives, I just want to give everybody a moment's relief in saying that we're not going to get through all of those objectives today. So some of this we're going to be going through in the next session. So hopefully you can all attend for both sessions. So that being said, I do want to introduce myself and talk a little bit about who I am and why I'm here and why I think I'm here. So my name is Amy Brinkley, and my day job is I work as the Recovery Support Systems Coordinator for the National Association of State Mental Health Program Directors, which is a huge title. Layman's terms, I work with state recovery leads in implementing recovery support services nationally. So we work with all states and territories. That's kind of my day job. Now, my personal experience is I am a person in recovery from both mental health and substance use disorders. And I have, by the grace of God, been in recovery now for 14 years. And I also have a criminal justice background. So in the recovery space, one of the first things that I was told is that, drugs and alcohol lead to jails, institutions, and death. And so by the grace of God, I got out of that and have been living in active recovery for 14 years. So that's kind of how I got started in this space. When I went to jail, I actually worked for a large manufacturing warehousing facility and was in corporate management for many years. And behavioral health was nowhere on my radar, was not part of my 10-year plan. But God had a different plan for my life. I've lost 3 brothers to suicide, my mom to an overdose. Coming out of incarceration, I got certified at the gate, basically. So I was still in work release when my case manager said, hey, I really want you to go through, sorry, I was checking the chat, to go through and get your certification as a peer. And I had no idea what that was. And so I got certified while I was still in work release as a peer. But the first 3 years of my my certification and my time working as a peer wasn't working. I was volunteering. So I couldn't get anybody to hire me because of my felony background. So I worked as a server at Pizza Hut, huge fall from grace, in my opinion. A very humbling experience for the first couple of years coming out. And but I also got a lot of experience during that time volunteering. And then that volunteering led to a position for a community mental health center in Gary, Indiana, working with the inner city kids, trying to launch a nonprofit. We tried to start a local NAMI chapter, which fell on its face. And why I'm telling you all this is because my experience when Chris was talking to me about doing this, I'm like, are you sure you have the right person? I'm not sure I'm the one that's the best person for this job. But then as I started really putting together the materials, I was like, okay, so maybe I have learned a few things through the process that would be helpful to others. So I'm hoping that you guys will find this helpful as well. But I went from there, from working at the Community Mental Health Center in Gary to working at the state. I worked for the state Indiana Division of Mental Health and Addiction for about 5 years. I was eventually promoted to the first appointed director of recovery support services for the state. And we were able to move our budget from about $170,000 to just over $10 million. We were funding one recovery community center when I started working at the state. And when I left the state in 2022, we were funding just under 30 RCOs, recovery community organizations. So I know a couple things about increasing budget and kind of, I have some insights as to what the states are looking for when they're funding recovery community organizations and whatnot. So I'm guessing that might be why she thought it was a good idea to ask me to do this. So I will do my best to live up to whatever the hype is that you guys came to this meeting with. I look forward to getting to know you guys as well, and hope that if you haven't already put your name and organization in the chat, then please do so now. Would love to hear what state you're calling in from. Wasn't really sure how many people would make it. I know there's a big national conference happening in LA, as Steph alluded to. So really wasn't sure how many people we would have on the call today. So please put your information in the chat if you haven't done it. And then we actually have a couple poll questions for you guys too. So if you don't mind humoring us, Cindy, do you want to share the poll?
Can you see it?
We can see it. I can see it.
Awesome.
So,
Okay.
so the first question is, how many years experience do you have working in an RCO? And so we're just trying to get an understanding of who we're talking to today and where you guys are at in terms of working in an RCO.
We've got about half the votes in. Can give them another 15 seconds.
This is very helpful, you guys. Thank you. It looks like
Oh yeah, thanks for adding to the chat what setting you're in if you are not an RCO. Okay, well, we've got 72% of the votes in.
that's
So
good.
with the high sign, I'll go ahead and end it, but we have a lot of people with more than 5 years.
No,
So
this-
should I?
Yes, so it's very helpful. And I did want to just note, so the NA, it's helpful for us to understand because I primarily prepared this presentation for Recovery Community Organizations. So knowing how many we have that aren't working in that space, I still think there's going to be some content here that you will find valuable, but I just disclaimer, a lot of it is targeting RCOs. But yes, let's go ahead and go to the next poll.
Okay.
So this
Gonna
question,
share
go ahead, Cindy.
Just a second. Here it is. Great. Okay.
I'm personally very interested in seeing how people rate this. And maybe this one, Cindy, we go ahead and share the results.
You want to share the results?
Yeah,
Sure.
I think this one will be interesting
Okay.
for folks.
Got about 5 more people if they want to participate. Okay, 4. I'll give you 5 more seconds. Okay, I'm going to end it and I will share the results. Can you guys see it at very important? We have 87%. Is
So
it showing?
on my screen it is. I think it's showing for other people too.
Okay.
So
Okay.
if it's not showing for you, if you can put a comment in the chat, I just want to make a note. So what stands out to me from this is that a lot of the folks who responded to the first question noted that they had some time working in an RCO. And then this reports to us that you guys recognize the importance and the value of data, which I just love. Because I'll tell you, when I started in this space, I could care less about data. And, you know, working in state government, I learned very quickly how important the data collection was and still is in terms of sustainable funding. And so it's, you know, in educating our local community here in the state of Indiana, it's been a journey. And so kudos to you guys for already recognizing the importance. We're going to have a great discussion. All right. So we can go ahead and segue on. Let's see here if I can figure out the change screen button. So where I wanted to start, I really wanted to do some level setting, and I ended up sectioning this off into 3 different parts. And so one of the things that I noted as I was digging into materials for this presentation is that the Peer Recovery Center of Excellence has recently put out a number of amazing reports that if you haven't seen yet, you should see. And guess what? You're going to see, because I'm going to talk about some of them today. So some of this, we're kind of going through, in my opinion, together. So I'm not looking at this as in I'm teaching anybody anything. I'm looking at this as let's learn and dive into some of this together. And any content or any context that I have through the state lens, I will try to share with you. And as you guys have questions, put them in the chat so we can monitor. And if you have insight and feedback on things, put it in the chat, share your wisdom. So that we can all learn and grow together. Oh, and before we get into the part one, I forgot we have one more poll. So we need to go ahead and launch this. So in terms of this poll, what we want you to do, this actually relates to the report we're about to look at. So please rate the following recovery community organization capacity building themes in order of importance to you. So when you're looking at these 7 different things on your screen, how important are these to an RCO, to a recovery community organization, in your opinion? And folks might need time to think about it.
This looks a little different than when I created it. They had columns to the side that you can put a 1 through 7 in. So I'm hoping it is making sense to folks. I played with this a little bit. Okay, I've got 2 votes. I think people are just
Probably trying to think.
figure it out. Yeah, this was set up odd to me. I wasn't sure.
Daryl, you're correct.
not
They're
the
all
way you-
absolutely vital.
Yeah, not the way you set it up, but the way that they have the advanced polling now in Zoom. It had columns and rows. Okay, I think people are getting it. Now the fun part will be if we understand it.
Looks like we've got about 10 so
Yeah,
far.
we've got
About
10
half.
out of 19, so we'll give them a few more seconds. 11.
Well, they're still.
So thinking about it, yeah.
So Barbara says she can't see the full screen that has all 7 columns.
I
Maybe
understand.
just scroll down.
Yeah, if you're on a laptop, it might be difficult, but we had 7 choices, so I couldn't make it shorter. Anyway, well, we've got a good number of responses. You want me to end it now, Amy?
Yeah, that's fine.
Got it.
Thank you so much.
Okay, and we will share the results.
Yes, let's go ahead and share just so that everybody can see how folks responded and where you kind of lined up in the big scheme. And we're gonna dive into some of this too in the report.
So I think it's by color. That's interesting.
It is, yeah.
Oh, I don't know if you guys hover over it, if it shows up.
Oh, yeah.
Sorry, I should have practiced this more. Okay.
So it does kind of look like funding.
Yeah.
It is kind of landing out on top with 7. And then the next one was leadership development, maybe, if I'm reading it right.
I'm thinking. $23.
That's fine, because
I'm sorry, this is not easy to interpret, is it? I'm gonna take a screenshot of it just so we can at least compare it. Okay,
Thank you for doing that. Thank you guys for participating in the poll. We're gonna dive into it. And it's okay if you rated it differently. The poll is nothing more than for you to reflect back on when we get a little bit further into the presentation. So it's a personal thing. One of the things that we wanted to do, Daryl. So, so one of the things that I wanted to do was really set the stage. So I wanted to do some level setting on when we talk about RCOs, what is the definition of an RCO? Wanted to talk a little bit about the Peer Recovery Center of Excellence and the report and what we're going to kind of go through together here. So when we talk about RCOs, we're referencing, at least within this needs assessment report that we're about to go through, we're referencing RCOs as grassroots, independent, nonprofit organizations founded and led by the local recovery community. So the Peer Recovery Center of Excellence, you're all aware of. I mean, you were on the website at some point to sign up for this, but really the Peer Recovery Center of Excellence is here to support the growth and expansion of the peer workforce. The PRCOE helps increase the prevalence and capacity for RCOs. And I wanted to make note of recovery capital because we're going to be talking about that specifically as it relates to the data periodically throughout the presentation. And recovery capital is the breadth and depth of internal and external resources that can be drawn upon to initiate and sustain recovery from alcohol and other drugs. Recovery capital can be grouped into 4 categories within the internal and external factors. So the internal is human and physical capital, and the external is social and cultural capital. And also wanted to note the National Drug Control Strategy report from 2020 that emphasizes the need for community-based strategies to increase continued care and recovery support in the community. By building the capacity of RCOs, we increase the community's recovery capital and the necessary resources to facilitate and sustain the recovery process. I will say that the National Drug Control Strategy report was spot on, and they're not the only ones that are echoing similar recommendations and encouragements to states and funders. There's a lot of, for example, the Bipartisan Policy Center just released a report, encouraging the integration of peers to help fill the behavioral health workforce shortage, which we're in a state of crisis. And a lot of new reports and recommendations are talking about funding and supporting peer-run organizations in general. So great stuff. So level setting. So here we wanted to talk about that RCO needs assessment from August 2021. So it was a digital survey that was sent out. Well, let me show this disclaimer. I was not part of the survey. I found the survey results and thought it would be helpful for the context of this. So if any of your questions come in specific to the survey responses and stuff, I think Cindy or maybe even staff might have more insight to responding to those questions. But this was a digital survey that was sent out to 210 RCOs, almost every RCO in the country. Respondents were asked to rate their level of need in 8 areas, including financial, management, and funding. And a 34% response rate was achieved, which is not bad. Funding was the top need, with 82% identifying this as a need, and financial management was ranked at 32%, which was the bottom 3 needs. There were additional focus groups which revealed some things, which this is not an exhaustive list. All interviewees expressed inadequate funding and insecurity about future funding. Most of the funding that they received comes from government funding. There was a note of significant competition among existing RCOs. Few RCOs have healthy, diversified funding streams. RCOs in some states can't bill Medicaid and some can, but the reimbursement rates are too low. Speaking from stepping back a moment, speaking to that, most RCOs cannot bill Medicaid that I'm aware of. I think Colorado was the first one that was integrating legislation to allow for billing for RCOs directly, unless they're partnered with a community mental health center of some kind. But the reimbursement rates are low nationally. RCO leaders don't fully understand pros and cons of Medicaid reimbursement. I would say a lot of state folks don't understand the full pros and cons of or ins and outs of Medicaid reimbursement. And then there's no national standard around peer wage reimbursement. So the little box on the side of your screen says 8 themes that were consistently presented. We're going to talk a little bit about a couple of those areas. So passion and a sense of ownership, funding and sustainability, building and generating revenue, staffing, stigma, misunderstanding, silos and gaps in rural areas. So probably not too surprising to most of us if we've been working in an RCO for a while. So in that first box, some key observations around the passion and sense of ownership, the majority of RCOs started by people with lived experience. So I myself identify in that same vein as well. Once I've been at NASHBID now for coming up on 16 months, but when I worked at the state, I couldn't do anything in the local community really other than volunteering because of my role in state government. But now that I work at the national level, we've started a faith-based nonprofit called Paul's Plan in honor of my brother who took his life 5 days post-incarceration. So our nonprofit is focused on helping people coming out of the criminal justice system re-enter the community successfully. So I'm personally not surprised by the fact that a majority of RCOs are started by people with lived experience because there's passion. People with lived experience are the right people to lead RCOs. RCO leaders need more self-care, support, training, and resources. Unfortunately, burnout rates are high due to lack of adequate sustainable funding, staffing, and training. So hopefully this presentation is addressing some of that. As far as the funding and sustainability key observations, nationally, RCOs are underfunded. So if you're feeling like your RCO is underfunded and you can't do the things that you want or give the right, raises and promotions that you want to, you're not alone. It's a national issue right now. Most of funding for RCOs comes from government grants, federal funding getting to the states, but not always reaching the community level. I can understand how that could be with block grants funneling through the states. It's just a middleman that's often, I'm not going to say oftentimes unnecessary, but sometimes it's unnecessary. There's a lot of competition among RCOs and other nonprofit community organizations. Very few RCOs have healthy, diversified funding streams. I would say very few organizations in general have diversified funding streams. And honestly, that's the key to a healthy financial organization is having diversified funding. But how you do that is what's a little bit more harder and complicated for folks. So many RCOs lack funding to hire volunteer coordinators, which could honestly change everything. And I say that for our Paul's Plan ministries as well. So the next two, we're going to talk about billing and generating revenue and staffing. So in the billing and generating revenue, some of the key observations were that not every state allows RCOs to bill for peer support services. Some states added peer support to Medicaid, but discontinued funding and block grant for RCOs and peers. Some RCOs have contracts with hospitals and other organizations to bill for peer support. We're seeing this again, and it's a common theme that comes up nationally. There's no national standard for wages for peer workers. Many RCOs who qualify for Medicaid reimbursement rates state it's not enough to provide peers a living wage. RCOs don't have a full understanding. We just talked about that in the previous slide too. So we'll skip over to staffing. So most RCOs don't have enough staff. Peer support workers are required to perform administrative or operational roles in addition to direct service work. The skills needed to run and support an RCO are broad and diverse. They include soft skills, writing skills, data collection, proficiency in technology, and leadership skills. And then staff and volunteers are susceptible to burnout. Probably not very surprising to most people, but we can talk about it. So highest to lowest listed here is capacity building needs that were identified from RCOs nationally. So as you will see here, this is based off of the same poll that you guys just answered earlier. So you can kind of see where where you responded compared to where nationally the response was. So funding was the top priority for RCOs nationally. The next one was community and stakeholder engagement, followed by volunteer management, then evaluation, leadership development, financial management, boards and governments. I really wanted to just kind of stop here for a moment and ask, is anybody surprised by anything? Is anybody surprised by anything that we've talked about so far and or by these results? Rhonda says nope. I agree. Aisha says nope. I'm not surprised myself, honestly. So let me ask you this. Does anybody think that a lot of these issues are normal for any startup organization or a nonprofit community organization in general? Do you think that these barriers exist for organizations and nonprofits in other spaces? Yep, I agree, Aisha. Normal for most nonprofits. Here's what I'll say. When I worked in state government, yes, Rhonda, I think it is across the board. When I worked in state government, we were trying to build what we called regional recovery hubs. And so we had one state funded recovery community center, historically speaking, and we went from 1 to 30. So we were literally building the plane as we were flying it. And so what we recognized was the need for, there needs to be capacity building space in that. Specific to admin, related needs. Like these were things that we hadn't done before. We knew that local recovery communities across the state were doing volunteer work in their local community and partnering with local advocacy groups and advisory boards, but there was no coordinated effort. And so for us to start funding groups to provide formal recovery support services, there needs to be funding. There needs to be leadership development type activities that support the growth of that, because you don't just get from A to Z overnight. There needs to be some capacity building that happens within the organizations. And as a state agency, one of the things that we did is we partnered with Faces and Voices of Recovery. We contracted with them to come in and do a formal needs assessment of our state. And then from that, year 2 was Faces and Voices of Recovery coming in and then providing the needs that were identified in the TA needs that were identified, so that they could help our RCOs build capacity across the state, because it's not an overnight process. It takes time to build something that hasn't historically been involved in our systems, right? So recovery support services, although they're not new, the formal component of recovery support services of the last few years, I feel we're still growing into, and I feel that the funders are still trying to catch up and figure out how they can be most supportive. So I wasn't surprised either, you guys. All right. So part 2, optimizing recovery funding. So they separated this in the report into 2 volumes. Volume 1 was reviewing the methods, findings, and recommendations from a national assessment of the challenges and successes experienced by organizations in the ecosystem of recovery and securing sustainable funding. That's a mouthful. Volume 2 reviews the methods, findings, and recommendations from the analysis of how states allocate funding to organizations for recovery support services. So one is talking about securing sustainable funding, and then the other one is talking about how states allocate funding. So volume 1, key findings. Federal grant applications are highly complex, and organizations do not receive useful feedback or resources on how to improve their submissions. Requirements for the receipt of federal funding often necessitates resources for organizational grant administration, which are not allowable expenses in the grants. Organizations primarily serving underserved and minoritized communities feel excluded from existing funding opportunities, and existing funding streams often have restrictions that limit their utility in supporting the implementation of recovery support services, requiring diversified funding for sustainability. So in terms of this first one, I'll just say oftentimes, when you submit a grant application or you submit a proposal, you just get a hard no. There's no redirect. Interestingly enough, here recently, especially with the rollout of the CURSA and ARP funding nationally going to all the states, it seems like there's been some, I don't want to say reckoning, but there's been some revelation on the part of national and federal leaders in understanding that there's a gap for folks, because they're starting to develop funding opportunities that provide TA for organizations that have not historically been funded, and community-based organizations. The Bipartisan Policy Center report talks about CIC, it recommends the integration or implementation of CIC, which stands for Community Initiated Care. And it's really meant to be local recovery organized support response to whatever the issue is. And so, it's basically telling the state leaders to take a step back and let the communities figure out what they need, and then give them the funding to do it without all of the extra policies and guardrails and all of the extra, shenanigans that oftentimes honestly come with government funding. Admin has restriction, or my thoughts are that admin has restrictions no matter the funding source. And for block grants, for example, the federal guidance is a 5% funding cap for admin costs. But we know with startups, they need so much more. So in the state of Indiana, when we were building the plane as we were flying it, that very first contract was huge, and there was very limited restrictions on what they could do with the funding, because we knew that they needed time to figure out what to do with the funding. And that's admin costs for them to figure out, to train staff, to get staff up to speed, to do the outreach, to do the marketing, and all of that related to admin. So we gave so much more in terms of admin. A recent announcement from SAMHSA, which this may be new to some folks, a recent announcement, which we're waiting for clarification for sure for now, is that the block grant guidance is 5% caps for admin, and I guess that includes, according to SAMHSA, subrecipients of block grant spending. So, for example, when I worked in state government, most of our block grant monies was a pass-through, so we were using block grant dollars to fund RCOs. So that would have meant that any contract that I had as a state person, as a state rep that used block grant funds, I would have to make sure that the RCO did not exceed that 5% admin. And so that's going to restrict funds, especially with contracts with colleges and universities. Like, it's just going to really impact the field. So we'll see where that lands. But hopefully we can get them to come back on that a little bit, because 5% admin cost is not, it's just not enough. All right. Enough yapping from me. Let's move on. So volume 1 recommendations. SAMHSA should reduce the complexity of the grant process and provide feedback and customized support for recovery community organizations and peer-run organizations to build their capacity to win grants. I would say nationally, some of that is happening, even in state government, some of that is happening, but not across the board. It does need to be standardized across the board. Number 2, federal and state funding agencies should provide greater flexibility in the allowable use of funds. Absolutely, ! _ all caps. Jump to number 3, funders should develop inclusive and culturally responsive funding opportunities that take into consideration the unique needs of historically underserved communities, such as the fact that data may be lacking for such communities. I can't underscore that enough. When we were launching our RCOs, we didn't have any data. There was no data to collect. And so we were really on the hunt for how to even start collecting data. So funders need to, or I should say, I don't want to say what funders should do, because that's not very helpful when you're the one seeking funding. But as somebody who's seeking funding, what you could do is make sure that you write into your grant proposal, do your own research. So let me use Paul's plan, for example. Do your own research, understand what data collection tools exist, get quotes, and find out how much it's going to cost, and include that in your grant proposals. Because the funders know how important data is. They know that in order to effectively measure outcome and return on investment and make sure that what they're wanting the money to do is actually doing what it's supposed to do, there has to be data collection. So as somebody seeking, or as an RCO, we should be doing our due diligence and understanding what data exists and then what the costs are to achieve getting that data so that we can report back to the funders what they're asking for. And if there isn't any data, then, write it into a grant and have it paid for that way. So funders should support funding for recovery organizations' entire portfolio of recovery services and reduce the administrative burden of grants management to provide time and space for these organizations to focus on sustainability. I agree with that. I do agree with that. I will say that that's not unique to our field. In terms of community mental health centers, for example, that are primarily getting Medicaid funding, it's the same thing. They've been screaming for years that the Medicaid reimbursement rates are too low and it doesn't cover the costs of, professional development. It doesn't cover the cost of supervision hours spent. It doesn't cover all of the administrative burden. So I think it's not unique to us. So level setting part 2. So optimizing. So this is the second part of this. So the 32 state respondents reporting full financial information spent $412 million on recovery support services from substance use block grants. That's since been changed. So I'll have to update this. Discretionary grants and state appropriations. This funding was spent on 6 categories of recovery support services in fiscal year 22. And when sent out to all 50 states using per capita averages, this represents an estimated $718 million nationally. Recovery community organizations were the organization type identified by most states as providers of recovery support services. Both community and government stakeholders noted the need for clear reporting requirements and standardization of definitions of recovery support services in order to adequately track and report what was offered to whom and with what effect. Here's what I would like to say about this section. So SAMHSA's Office of Recovery is doing a significant amount of work in achieving that. So in the Biden Unity Address, in the fact sheet that came out in 2022, Biden announced a push for convening stakeholders to standardize national peer certification. So SAMHSA has reinterpreted that to really hone in on what the needs are for the peer recovery community. And they're hosting 16 different technical expert panels this year. But specifically, they are even more recently, I just had a meeting with them last week, they're more recently looking at updating block grant data. Sorry, I can't talk all of a sudden. There is currently a block grant data change request submitted that adds data specific to peer recovery support services. Because historically what's happened is SAMHSA, Congress designates the funding to SAMHSA, SAMHSA designates the funding to the states, and then the states are distributing funding, but there's no real coordination around recovery support services. It's really whatever you can get your state to fund, or whatever your recovery support service director can get the state to fund. And then there's no formal data collection. It's just not, there's no standardized approach to it. So with this block grant data change request going in, it's going to force states to track what they're doing with block grant. So if your state's using block grant funds to pay for recovery support services, then they will be forced to track what they're doing with it and how many people they're serving. There's not any recovery oriented outcomes specifically. It's more widget based, but still some sort of way of tracking what states are doing in this space is going to be crucial to elevating and professionalizing the space and honestly securing long-term sustainable funding. So it's a huge win-win for our field, in my opinion. And then the final one here is the analysis identified the need for additional efforts to reach and support peer-led community-based organizations, especially BIPOC, lesbian, gay, bisexual, transgender, queer, two-spirit, rural, and other underserved populations. So I'm not really tracking the chat. So if I'm missing anything, I apologize. And Steph or Cindy, feel free to jump in and interrupt me at any time. So volume 2, I'll try to move through this a little bit quicker too. Volume 2, states should report to SAMHSA the amount of money from substance use block grants and other discretionary grants spent on recovery support services. We just talked about that. They're working on it. Funding agencies should develop approaches to expand and diversify the applicant field in order to better match community needs, address gaps, and build capacity. States should establish and increase opportunities for training, TA, toolkits, and learning collaboratives. SAMHSA should initiate a consensus process. SAMHSA should, a lot of this is SAMHSA should. And I feel like with the new Office of Recovery, they're trying to do as much as they can in a very short amount of time to address a lot of this. So kudos to the Peer Recovery Center of Excellence for capturing this information to feed it back to the Office of Recovery so they can do something about it. The Office of Recovery and SAMHSA should clarify and communicate the vision for recovery support services. They've done that. There's a national recovery agenda that's been that's public. They're working on a national recovery research agenda as we speak. They've got principles developed. They've really beefed up in this space since this survey, since these results were reported. Let's go to the next slide. So defining the ecosystem of recovery. So the original priority population of this assessment was RCO leaders. With guidance from the subject matter expert panel, this focus was expanded to include leaders of any organization in the ecosystem of recovery, which I love because there's a lot of organizations and allies helping in the ecosystem of recovery that aren't necessarily RCO leaders. 5 core pillars describe the ecosystem of recovery as save lives, engage community, expand treatment, screen for and prevent substance use disorder, and support recovery. This ecosystem includes recovery community organizations, recovery community centers, peer recovery organizations, recovery housing, recovery high schools, collegiate programs, recovery peer support, and recovery cafes. In short, RCOs, peer recovery community organizations, or any other type of organization that provides substance use disorder recovery support services are part of the ecosystem of recovery, regardless of whether the organization meets the criteria for an RCO. I love that. I might have to steal that for some other stuff. So here's a table that explains the spending by source for recovery support services within an RCO. So looking at nationally, this looks like, hold on, let me read this. Due to one state reporting substance abuse block grant and state funds together, that state has been removed. Okay, so this shows that the dollars spent from substance abuse block grant is 126 million, which is 34% specific for recovery support services. And then in discretionary grants, 125. Total federal is 251. Cindy, or I don't mean to put you guys on the spot because I know I'm the one that's supposed to be presenting this, but if you guys have any additional context to add for this, is there any additional context that you guys want to share?
I'll let Steph answer that since she was in on the report. I don't.
Yeah, thank you so much. I'm pretty sure when looking at this, because I helped write the volume 1, not the volume 2, but in context for this, when it comes together, we just wanted to showcase that there is money missing and why it's hard to track this money and where that money is going to. And also the interesting structures that some states have in terms of how they report their funds together, because there isn't really clear delineation for that. And so I think that can be frustrating for folks who's trying to access funds, like tracking where is this even coming from, where is it going, and how can we best report this out so that we can efficiently track that. So just wondering those different pieces there for sure.
Gotcha. Thank you. Don't go anywhere yet because I've got this next slide too. I don't know if you have any context here that you'd like to mention. I mean, this to me just reflects a breakdown of how the funding was spent, or I should say where the funding was spent within each of the recovery support services.
Yeah, absolutely. So out of the different regions, it was easier to put them in regions instead of pulling out the specific states. And Washington, D.C. is also listed within the Northeast region, just for some context there as well. And so out of all of these regions reported, this was the data they were able to gather in terms of where these funds are going. But I still think it's interesting to see such big numbers. In my mind, I think it's significant to note in other that there are funds that's supposed to be allocated for the field of recovery and substance use disorder and treatment that is marked as other. And now that could be a variety of things that they're using for that, but it's interesting to see how this is being tracked, and where the money's going and where it's not. So just pointing out those pieces.
No, thank you so much for sharing that. You know, when I see this, one of the things that I'm thinking is that no matter where you're at in the country, I would want to know where the money is going. Is this money going to a recovery community organization, or is this money going to a community mental health center to provide recovery supports? And then they're contracting out, because, that just cuts more and more into admin costs necessary. And why wouldn't they just fund directly with the recovery community organization to provide that service? So it would be very interesting to see. Although they're funding, we're very happy. We want to say thank you, thank you, thank you. We're very happy that they're funding so much money in the recovery support services space. Hopefully we can get better at tracking exactly where the money's going and exactly how it's being distributed within the organizations that are receiving the funds. And hopefully with some of these block grant data change requests, some of that will be tracked better. Thank you, Steph. I know I kind of put you on the spot there. So one note I wanted to point out is one comment from the report is that they are so overwhelming. Grant applications and the need for training organizations in the ecosystem of recovery cannot receive the benefits of federal funding if they do not know how to apply or feel discouraged from applying due to the complexities in writing and submitting grants, as well as the time needed to do so. So level setting part 2, we're still in the optimizing recovery funding. So the complexity of SAMHSA grant applications, the ability for organizations in the ecosystem to be successful in acquiring federal funds or in acquiring federal funding requires submitting the grant application. So as shown in table 1, only 55% of all organizations applied for funding directly from the federal government, with independent RCOs and recovery community centers doing so slightly less than other types of organizations. Substantially more, 77% applied for state funding. I'm not surprised by that number either. If you're surprised or you have any thoughts, please put them in the chat. Would love to hear what your thoughts are as you read this. I saw that too, Barbara. Yeah, so yeah, there was a letter that was written to SAMHSA demanding an accounting of the COVID money, and it did seem very targeted towards the Office of Recovery, but it'll be interesting to see what that report looks like. Yeah, that's all I'll say about that. So, okay, so we'll keep moving. So for one organization's leader who participated in the Native American and tribal community listening circle, grant requirements eliminated nearly all potential applicants who provide peer recovery services to Native American community members, which makes me so upset, you guys. It makes me so angry because I've lost 3 brothers to suicide, and I'm a registered Comanche Nation tribal member. And so when I think about the need of the Native American community, they need support. And so you would think that we would find, I say we because I worked at the state for so long, I'm now working with other states providing, support. You think we would be able to find a way around it rather than just saying, no, we can't fund you. How can we work with this organization to make them eligible, and bring them up rather than just give out a hard no? It just seems like there should be a way to work around that. So I did want to point out that we still have work to do, and state leaders and funders still have work to do. So state of the state. So in my role in state government, I was chairperson for the National Division of Recovery Support Services. In my new role with NASHBIT, I am now the the staff liaison to our National Division of Recovery Support Services. In 2021, we issued a survey that went out to all of our recovery support division leaders across the country. And so the survey went out to 44 states and territories, and we had 19 states and territories that responded. We're not going to go over all of the results in today's session, but I did want to point out some of them. So some of the key takeaways from that survey was that there were 20 distinct recovery support service types that were identified across 12 diverse populations that were being targeted across the 19 states. 12 diverse state agencies and systems involved in recovery support implementation, which to me, what that translates for you guys, the key takeaway for any recovery community organization is that there are 12 different state agencies and systems involved in recovery support services implementation, which means there are 12 different state agencies and systems involved with distributing funding for recovery support services. So if we're going to only SAMHSA funded organizations for funding, whether it be the state office or what else, there are 12 other agencies in this space that are interested in addressing this issue that we could be potentially seeking funding from. And one of the things that I've taken away from that too is, even with Paul's plan, is that, you know, our first grant that we received was not even from the Division of Mental Health and Addiction, it was from the Department of Health. And so when we're looking at identifying funding, we need to identify shared visions and shared outcomes with other state agencies and other funders as well. So for the Department of Health, it is the social determinants of health. You know, we did a whole crosswalk in Indiana looking at recovery support services compared to social determinants of health. We're almost talking about the exact same thing. So, you know, we can be creative in how and who we go to for funding. It doesn't just have to be SAMHSA funded funders that we go to for funding.
Hey, Amy, really quick, there's a question in the chat, and perhaps you'll get to it on this slide, but just curious about what are the 12 agencies that provide funding?
You know, I don't think I get to it here, but here's what I'll do as a follow-up to this, Steph. If we can send out the actual PowerPoint, I will send out the full PowerPoint results to all of the survey. So, and share that with everybody, and they can do a deeper dive into it. I don't remember what they were off the top of my head, unfortunately. Okay, sorry about that. I was trying to target funding and I didn't think about the agencies, so I apologize. So of the 19 states who responded, 19 of them reportedly were using mental health block grant, 13 states were using substance abuse block grant, 17 states are using state funds, 15 states are using Medicaid, 16 states reportedly were using state opioid response dollars, 1 state reported local funds, 5 states said other federal funds, 4 states said other state funds. Ooh, I almost hit the wrong button. So on this slide, I want to point out to bill Medicaid for peer services, there must be so this is the CMS guidance from 2007. And what we know right now is that all states but 2 currently offer peer support, and California is working on it. So a majority of states, I think actually all states, if not a majority of states, allow Medicaid reimbursement for peer services. The kicker here, though, for RCOs is that to bill Medicaid for peer services, there has to be an individualized care plan in place for the beneficiary. So seeing as how recovery community organizations are largely not Medicaid treatment providers or clinical providers, we, you know, peers and recovery community organizations don't have an individualized care plan. So it almost puts RCOs in a position to always be subservient to a community mental health center or a clinical treatment provider, because if you're going to bill Medicaid, there has to be a treatment plan. It has to be listed in the treatment plan. And that oftentimes also it does require clinical supervision as well. So it just introduces a whole bunch of obstacles for recovery community organizations, which is why a lot of them are not billing Medicaid, because there's too many ways that block that as a possibility. So states can choose to deliver peer supports through several Medicaid authorities, including state plan rehabilitation options, 1915 waivers, state plan amendment, 1115 demonstration waivers, and the health home state plan option. What I'm seeing across the country is that a lot of states are utilizing peers to various degrees in all of these, or if not most of them. So the question then becomes, how and where do recovery community organizations fit? Well, one thought I've had in working with states is that we have a rollout of the CCBHC model, the Certified Community Behavioral Health Clinics, which is supposed to be a step up from the community mental health centers. And what's been dictated is a requirement for CCBHCs. If you are a designated CCBHC, you have to provide recovery support services. So historically speaking, we all know that a majority of the community mental health centers don't typically hire peers. At least in the state of Indiana, they didn't. Less than half of our community mental health centers would hire peers. So it's not heard of. And so with the CCBHC rollout, mandating recovery as a requirement to be provided as a support, it's forcing community mental health centers and CCBHCs to hire peers. And not all of them are still doing it. Some CCBHCs and states are pushing for what they're calling DCO, which is a designated, don't quote me on this one, a designated care option is what I think it stands for. I know it's DCO. I just can't remember what the C stands for. And basically what that means is that the CCBHC may not, the CCBHC is required to provide peer recovery support, but they may not be the ones providing it. They've designated another organization to be the primary caregiver of that service. So what that looks like is recovery community organizations contracting through an MOU with the CCBHC to provide that peer recovery support in lieu of the CCBHC hiring peers. Sorry, that didn't come out as clear as it is in my head. So I hope that made sense and didn't make it more confusing for you. So, I presented at the National Dialogues Conference last year. And, as I was presenting, I was very, quick to share a lot of the resources and how states are implementing Medicaid and non-Medicaid funding for peer support services. So I wanted to especially make sure that I shared the resources with you guys as well. So this is just a list of SAMHSA grants and non-Medicaid funding opportunities for peer support. This is not an exhaustive list, but these were just a quick snapshot of resources for you guys to go to find funding for peer recovery organizations. And I will say too that there are some that aren't listed here. Local grants, for example, foundation grants. And I think about large manufacturing firms locally that fund and offer grant opportunities, especially for community-based organizations. Recovery community organizations should be getting into that mix too, because although we're not providing clinical support, recovery support is just as important, if not more, because as we all know on this call, as they're coming out, we need to be able to provide that ongoing sustainable support, which requires ongoing sustainable funding. And so we should be pushing for outside of the box funding opportunities from funders. So a couple of things to think about is that the launch of 988 and crisis services includes focus on peer support being integrated within the crisis continuum. So as we're talking about recovery ecosystems, the rollout of 988 and crisis services nationally is developing and creating a crisis ecosystem. And so something for RCOs to be thinking of and be very thoughtful about is where does my organization fit is what we should be asking ourselves. Where does peer recovery fit in the lens of crisis services? Because there's a lot of funding going out for crisis services, and all of the guidance federally that's coming down is for the inclusion of people with lived experience and peer support across the crisis continuum. But what isn't happening is a standardized approach to that. So it looks different in every state. And it's not even happening at all in some states. And so the question for all of us on this call is where do I fit, and where does my recovery community organization fit in crisis services within my local system or statewide system if you're at the state level. So here's another resource. The National Academy for State Health Policy has some examples of how states are implementing implementing peers within crisis services. And it also designates exactly how they're funding those peer supports within those crisis spaces. And then equally important to note is the SAMHSA Advisory on Peer Support and Crisis Services. I'm working on a peer across crisis services paper right now. And that SAMHSA Advisory on Peer Support is the only, and I will state it again, if you're aware of something else, please let me know, put it in the chat, blow Obama up, something, get my attention. This SAMHSA Advisory on Peer Support and Crisis Services is the only resource that is solely focused on peers within the crisis services. There's a lot of resources out there right now for crisis services that have one section, one paragraph, a couple sentences on peers. But this document is the only thing that's solely focused on peer support within crisis care. So it's been invaluable, but we can do better. And the people with lived experiences and recovery community organizations should be weighing in on the development of these types of resources within the crisis ecosystem as well, because peers will be part of that system. Top focus right now for all states is workforce. So the Bipartisan Policy Center issued a report calling for the CIC approach that I mentioned earlier, and called for the integration of peers and paraprofessionals to address the workforce crisis. The SAMHSA Behavioral Health Workforce Report called out 1 million peers as being as we are short 1 million peers. The SAMHSA 988 guidelines talks about the value and the importance of peers within crisis services and the value of people with lived experiences helping develop crisis services. And then the playbooks really focus on the actual implementation of 988 and where peers fit. And there's some examples and case studies in there. And then the National Council's, there's a typo here, but the National Council CCBHC use of peers, which I talked about already, with them designating organizations to be the peer provider. So it's kind of cut off here, and I'm not really sure why. I'm going to speed up here a little bit so we can get through these next few slides. So the Biden State, so the historical piece here is that the Biden State of the Union address called for building a national certification program for peers. The Biden statement on new mental health funding from October of 2022 named mental health as a core pillar in the Biden agenda. SAMHSA's office was launched in September of 2021, and they have just been ripping and roaring ever since. There's so many good things coming out of the new Office of Recovery. The definition of that office, if you don't know, is on their website. It's listed as a national clearinghouse and resource for recovery-oriented care across the mental health, substance use, and co-occurring domains. And when that office was announced, that was a lot of conversation nationally about whether they were going to be solely focused on mental health, substance use, or both. And there was an outcry for wanting them to focus on both. And that's where it landed. So folks are really happy. This is just an example, or this is just a visual of the Office of Recovery, the team. So I don't know if you know any of these people, if you're already familiar with this. I apologize if it's repetitive. I just thought it was important to kind of give you guys a visual of what that office looks like. And they're doing amazing work. So Grace Lee is the one that's leading the recovery research agenda work. And it's just been really, honestly, inspiring to see what they're doing. So the National Recovery Agenda, the purpose is to forge partnerships to support all people, families, and communities impacted by mental health and or substance use conditions to pursue recovery, be resilient, and achieve wellness. The National Recovery Agenda goals that they've released are inclusion, equity, peer services, social determinants, and wellness. Some Office of Recovery initiatives that the peer recovery community should be following closely are the SAMHSA Peer Support Certification Model Standards, which since I wrote this slide, they have since been, they released the draft for public comment. Public comment has since closed, but the final model standards have not been released yet. Another new thing coming down the pipeline is the Next Generation Recovery Oriented System of Care. So Next Generation ROSC, which is going to include a focus on mental health, is coming down the pipe. Peer respite cost benefit analysis. So with the rollout of crisis services, everybody wants to talk about peer respite. And SAMHSA's Office of Recovery is working on a cost benefit analysis that is expected to be released this summer. And then the National Recovery Research Agenda is still forthcoming. I know SAMHSA has sent out emails convening 10 to 15 recovery researchers nationally in July. And so my understanding is that from that meeting, they will be developing the National Research Agenda. So Office of Recovery core principles, data and evidence, trauma-informed rights protection. So I want to put a pin in the data and evidence piece is to increase the collection, analysis, and reporting of data on recovery and support the identification and use of evidence and practice-based policies and approaches. And based off of the poll at the beginning of the call, I think we're all in agreement that the data is incredibly important, particularly for the purposes of sustainable funding. So we're almost full circle here. And so we're going to go back to the poll. And now that we've had this long conversation, I feel like I've been talking for a year. And I don't usually do all this talking.
Okay, we do have poll 4, but I don't think that's the one you're talking about. Give me just a second to make sure. The poll 4 is how important it is for RCOs to capture data. Do you want that poll open or just go to the? Okay, that is the one. Whoops.
So you can see, and these are all different people that participate, and then there's like, you can
Sorry,
drag
trying to relaunch you.
around.
Okay.
So we're just trying to see if the needle changed at all.
Yeah,
That's our goal
you
here.
have converts.
I'm not a huge fan of talking for long periods of time. I feel like I've been talking forever. Next session, we were going to have more time, you guys, just so you know, the next session, I will not be talking this much. This was more of a didactic than the next session will be. The next session, we're going to have more interaction, and we're going to have more time to hear from you guys. You guys will have more time to hear from each other, and it's going to be more interactive. So just know there is hope. So
There are the results, Amy.
100%. I love it. I love it. So was that the last question?
We were gonna redo, it's the, here, let me launch it, but it's still a strange polling system. I tried to play with it. Let's see how that works. Yeah, it's those basic colors. So we were gonna go back and revisit this
Yeah.
one.
Yeah,
It was hard to understand. Skip that.
no, let's revisit it.
Okay.
I'm just curious where people landed, and then
Okay.
maybe once we get the results, Cindy, if you could screen or take a picture like you did with the last one, and maybe
Yeah.
we can share it on the next call with.
Yeah, and I think the download from today's meeting will have it more precisely. So one or the other will figure it out.
Yeah.
I think, I know, Mike Tyson, you put something in the chat that you voted 6s and 7s on a lot. And I guess the way it was, I was trying to set it up was 7 being the most important down to 1. So I've got a little work to do in the polling issue. Oh, I know I'm not sharing the results yet, but Amy, I think you can see them, and we're in a dead heat, it looks like.
Yeah. We've got 4 responses so far.
Yeah.
So yes, you were thinking maybe add
I knew it would be interesting to see these, comparatively speaking, from the beginning of the conversation to the end.
Mhm,
Because I found that
Definitely.
I found the assessment and the responses extremely validating, if you want me to be honest, because I wasn't surprised by any of the report or what the RCOs were responding in terms of the capacity building. But it was affirming to see the national consensus around these things that we all know. So
Agree. Okay, I don't know if folks want another few seconds. We've got 7 answers in. But yes, things have changed. And I'll make sure to, well, I have a minute. We are gonna send out the slides and the recording. We also have a web page set up for participants only that'll have all those things. And I can put the results of the poll once I download it, and it will make more sense, okay? So I'm gonna go ahead and end
And
it,
then, of course, here we got collaborative, we have all our.
and I'm
slides,
sharing the results.
fonts, How we want those to look.
it looks
And
like
number 7 is the most important, so the light purple.
Pretty exciting and
Looks like mostly in funding, but
Yeah.
close to leadership.
so far it has, I mean, of course.
so. This
we have
this
a
is
goal that-
this is landing somewhere near where the national survey landed.
They really don't- they need help, right?
Good.
They don't have
Okay,
Awesome.
ready to stop sharing?
Yep. Thank you
Okay.
so much for
Got it.
sharing
Sure.
that. Thank you guys for participating in that little experiment with us. So as was noted at the beginning, we do have a homework assignment, and I'll be honest, I'm not a huge fan of homework assignments, so it was really hard for me to figure out what would be the most helpful for this group without it being too cumbersome or having a lot of people come back and say, well, I just didn't do it because I didn't have time. I wanted it to be fun, and I wanted it to be something that was helpful, that you could take it and use moving forward. So what we know from the passion, sense of ownership section of the needs assessment, each RCO leader interviewed credited their passion and desire to combat addiction as the driving force behind their work. So the core passion lends itself to the positive and challenging implications mentioned here. So what you see in the triangle is that the 3 highest needs areas were funding, community and stakeholder engagement, marketing, and communications. So what I want you guys to do is be thinking in terms of your vision mission for your organization and how that lines up with the funding that you're going for, right? So we always, I've been saying it repeatedly, and I'm just going to say it again. So when we go after funding, we go after funding from funders who have the same vision mission. And sometimes we can think outside of the box. Remember, there are 12 diverse agencies now partnering with state agencies on recovery support services implementation. So you might be able to find other resources besides the traditional ones that fund recovery support services. So what I want you to do while you're striving for balance between mission and funding is I want you to identify 1 to 3 current grants that your organization could qualify for based off of an identified goal of the organization that you're currently working for. So it could be a federal grant, a state grant, and a local grant. Ideally, try to find 1 in each that you could go for. And remember, a couple slides back, I shared a whole list of non-Medicaid funding opportunities. So the federal grants are listed there, but your homework is to identify even non-traditional ones that still align with a goal of it doesn't have to be your whole vision mission, but you can typically we can find funding from non-traditional places that could fund a goal of ours, right? Even though they may not align fully with our vision and mission. So come to the next class prepared to share 1 goal or outcome of the organization that you work for, and share the identified grants you found that were most eligible for recovery community organizations. Also, we're gonna have some conversation about barriers, successes, questions, and any insights you had or aha learning moments that you experienced while doing this homework assignment. So now, if it's okay, I just want to stop sharing and talk to you guys, and let's just have a conversation. Do you guys have any questions? Are there any questions about the homework assignment? Any thoughts, feedback? I guess Steph, Cindy, did you guys track any questions that we need to track back to?
No questions to go back to that haven't already been answered or captured for follow-up.
Okay. So that gives us this time, you guys, just to chat. I know most people are off camera because we were mostly presenting the whole time, but please come off camera, unmute, ask a question, comments, any concerns about the homework assignment. You don't have to raise your hand, just unmute. This is your time.
You are very thorough, Amy. Aisha's agreeing.
Is it too much?
It was spot on actually, and you got me over here thinking. It's maybe even actually more than I anticipated. So I really appreciate this opportunity. So thank you.
No, thank you for sharing that. I have a coworker who makes fun of me that I'm so thorough. So sometimes when you said that, my first thought was, oh no, I was too much again. I'm trying to be helpful, right? And that was my goal, is sharing things that would be helpful. And I really do think that you guys, finding grants that could support your vision mission for your organization is only going to help you moving forward. And then I think, honestly, where we're going to get the most collectively, me too, from you guys, is during our next session when we have the conversation and we go over the homework assignments. I'm ready to learn from you guys, because I'm the first one to admit I am not the know-it-all, end-all, be-all on anything. I'm still learning, and I want to hear from you guys because I want to learn too.
Yeah. And that's in the work plans.
I'm not sure if this is the right place to ask this question, but I'm just wondering, any suggestions, ideas, or like things to look out for when applying for government grants?
Interviews, some videos.
Anything to look out for when you're applying for, that's a broad one. So here's the thing.
One line item,
My mind's going in two different directions on how to answer that. And it's kind of broad, so I may not give the best answer. When going for government grants, I would say ask questions, and always go back to the project officer who issued the RFP. So whoever put out the notice of funding, that's the person you go back to ask for questions. So I think too often what people do is they go to a website, they see a notice of funding opportunity, they go to the website and they read something on the website and they're like, oh no, we don't qualify, and then they just move on. And what we don't often recognize and remember sometimes is that there are people, like real people like me and you, on the other side of the screen, and sometimes they issue things and they don't even recognize or realize the full impact. And maybe you did qualify and it was a typo, or maybe you did qualify and they didn't realize how they had stated something, and we never know because we just wrote it off as don't qualify or don't understand, so we just move on. And we need to be poking and prodding. If we're ever going to see change, we need to be pushing and questioning and pressing the status quo.
Anybody else want to comment on that? Did I hear my name?
Yeah, that's what I was going to ask, if anybody else had any context or advice.
But just so you're aware. Yeah.
always make sure you check the language on a government grant, make sure it actually applies to you and what you're doing. If you are unsure and you have a local university nearby, I suggest touching bases with them. They can help you make sure that your language for a government grant is on point.
That's good information.
It is good. Yeah. Go ahead, Robin.
I'm kind of in a different situation than everyone. I've been in nonprofits for 22 years, and six months ago, I moved over to work for Colorado's Department of Law in grant making. So this has been really valuable to me because I'm trying to figure out grant making and how to really help those who are applying for the grants, which was me at one point. And one thing that I just wanted to point out is if the grant is a competed process, I wanted to remind everyone, this is something that I'm learning, that the staff, the government agency, they cannot legally speak with you after it's been posted. But in our situation, we're having a 2-week period where you can submit questions, and then all of the questions and answers will be posted on the website. We're having a webinar and 2 online office hours. And when it's public like that, and everybody can come and hear the answers, we can answer questions that you're having, whether it's technical difficulties with filling out the grant, or you're wondering if your project aligns with the intent of the grant. So those are the real opportunities to come back and ask the questions. And then after the award letters go out, I've also learned that that's the time that you can actually talk to the grant administrator and ask why you were selected, like through the evaluation process, the strengths and weaknesses of your proposal, or why you were selected. Just some things that I didn't know as a nonprofit person until I got on the other side of it.
Thank you, Robin. That's such helpful context. One additional thing to underscoring everything that Robin just shared is that one of the things I've learned in state government is that once that notice of funding announcement has gone out and that it's open competitive bid season, if you reach out to someone who works at the state in the same state agency and ask questions related to that, you can be automatically disqualified. So it's very important to understand everything that Robin just shared, because there are open season times for questions and you just have to know what you're doing. It's 2:30, Cindy. That's kind of what I have rolling around in my head. I don't know if you guys have anything that we need to close out with.
Not really. I put the link in the chat. We will be emailing all of you. But again, there's the private webpage that has all of our nonprofit basic sessions with recordings and all the materials that go with that. So feel free to look at any of those. And we hope to see you in a couple of weeks back here for the next session with Amy. Everybody have a good
Don't leave me
afternoon.
hanging. Thank you, guys.
Take care all. Thank you so much.